So you're thinking of moving to the low country, but you don't really have a network down here. You're not familiar with healthcare, how things work with mortgage lenders, insurance people, builders, things like that. Today, I'm interviewing Dr. H, as we call her, at the Fraum Restorative Health Center on Hilton Head Island. And I think it's really a good interview. They're part of Low Country Connect, where we've built this network for you down here in the Low Country. We're real estate agents and brokers. We sell a lot of real estate, but we also take it one step further, and we want you to be comfortable when you come down here and go to the right places. So anyway, stay tuned. We're going to have a great interview. If you like interviews like this and you like the content that I put out on my YouTube channel each and every Wednesday, please subscribe to the channel. It really does help the channel grow, and it exposes the channel to other people who are searching for the same thing you're looking for. So anyway, just hit the subscribe button and you'll get all the content first thing. I'm here today with Dr. Heather Hinchelwood. They call her Dr. H. And we are in Fraum Restorative Health Center right now. And Dr. H is a physician,
yes,
correct?
Yes.
Can you tell us a little bit about your background?
Absolutely. I am a medical doctor. I went to the University of Florida for medical school. Actually, my residency training is in emergency medicine. So big critical care background. Basically, anything from birth to death is within the scope of practice, right?
Right.
I've been doing that, again, over 20 years. I really, I have a background in the military too. So my default is to try to get people well so that they can be operational again, whatever that means for them. Okay. Also relates a lot to exercise physiology and biomechanics.
Right.
Okay.
Right.
So I just got to a point after 15 years of emergency medicine, I just got tired.
Here in Hilton Head?
No, all over the world.
In Afghanistan, right?
Yeah, Afghanistan, Okinawa, Southern California, and all over the South as well. So
right.
I just got tired of watching my patients deteriorate, and so many of the reasons that they were deteriorating were all about personal choices. But nobody was helping them with that. And so I would I still do spend a lot of time in the ER telling people, hey, if you'll do X, Y, Z, I'm not going to see you again for another heart attack. Right. And so I really, my viewpoint has really shifted. I would really like to keep people healthy because, considering my career and my point of view, that's really why I got into medicine, is to keep people healthy, not just to kind of patch them up getting worse.
Right. So now I'm here at Fraum Center because I had an aching back and I'm under treatment right now for that. So I just kind of discovered this, and that's why the more I thought about it, our customers moving down here, retiring here, they got an aching back. So restorative, that word is like a niche in the market, maybe?
It is.
Because we've got the Western way of living, which
Correct.
is diseases and everything else, but restorative, can you explain a little bit about that?
Yeah, so the whole point of view there and the whole goal is to restore health.
Yes.
Okay. Now I can't turn the clock all the way back, but there are things that we can do to remind our body how it's supposed to be working.
Right.
Okay.
Right.
Unfortunately, with time, a lot of things change, and our body forgets a lot of those healing processes. And so if we can remind our body, hey, you've got this squished disc, hey, let's take some pressure off, and remind the ligaments that they need to keep that disc where it's supposed to be, not let it spill out.
Yeah.
Or, hey, I've got this torn meniscus. Well, when I was 10 and I tore my meniscus, right, my body knew how to heal that. So how can we make that happen now? Is that possible?
Right.
So.
Well, the way, the old school way, everybody just lived their life and then went to the doctor. But now in the 20th century and medicine moving forward, I mean, I really think you're onto something here. And there's other places around the country restorative type of healthcare, right?
That's correct.
Rather than have a bulging disc in your back, go in, have Medicare pay for it for $400,000, right?
Yeah.
The federal government.
Nerve ablations, laminectomies, discectomies,
Yeah.
fusions, medicines, so many of which are addictive when you're talking about trying to relieve pain
Right.
and make it so somebody can just move around and take
Right.
care of themselves. There are so many disease processes that are so common that Western medicine does not have a good answer for.
Right.
And that's really where restorative medicine comes into play.
But I don't know if I'll see it in my lifetime, but I think we're headed in that direction of people being aware of what's going on, all the diseases, the chemicals in the food and everything else. And I think people are starting to take action. And
Yes.
I've been coming in here, I've had 10 appointments. It's always busy.
Mm-hmm.
And I mean, you got a thing going here.
Yes. Yeah.
What other services do you provide?
So we're really a comprehensive healthcare center, right?
Mm-hmm.
So you've been seeing Dr. McGinnis, who's one of our chiropractors. Right. So we have two licensed and very experienced chiropractors here in the office. Myself, Marissa Metter, who's a PA, we do the medical side of the house, okay? So we really enjoy keeping people well, but most of the time people come here because something's wrong, similar to why you joined us, right? Your back hurt and you came here. Mm-hmm. So that's most of what we get. So, if it's something that one of the chiropractors need to tackle, like your back, they go there, okay? When it's medical, they come to me, okay? A lot of times something has gotten out of control medically that patients, something happens in their life, they realize this is no longer sustainable for them. Weight is a very common one.
Okay, I was just going to ask, when you say medical, what do you mean? But
a lot of things, unfortunately, what I'm finding, I'm struggling to think of a single thing that doesn't tie back to metabolic health.
Yeah.
Okay.
Right.
Heart attacks, strokes, congestive heart failure, kidney disease, all these things. Right. At the end of the day, they tie back to metabolic health. Okay. And when your metabolism is sick, everything else is going wrong too.
Right. Exactly. So you offer, I see a line of vitamins and I think skincare. Is that correct?
And we do, actually skin is our biggest organ in our body. Okay. So we do also believe in restorative aesthetics as well. There are a growing number of people who are not happy with traditional aesthetics options, Botox or some other, neurotoxin.
Once again, getting into chemicals.
Yeah, well, I mean, so like I don't like a wrinkle on my face, so I'm going to paralyze a muscle to make that me happier about that. I mean, there are times that's appropriate, but I think much like a lot of things in Western medicine these days, I think we reach for it far too much.
Right.
When we should be worried about the health of the underlying tissue or the underlying organ of that's going wrong.
I don't think a lot of restorative health centers have physicians on duty.
No.
The owner are here.
Yeah.
Right?
That's true. And I'm really hoping that physicians will start to sit up and take notice, because what's happening right now is it's the patients that are demanding a better option. Okay?
That's a good point.
No, it's true. It's true because, hey, my back hurts. I don't want to go under the knife and everything else that's going to happen, after that. So you are demanding an alternate that is more in line with your values and your goals of care.
No, that's good. That's very good.
I will tell you from the physician side of the house, we are going to have to wake up and realize that patients are asking to be kept healthy and not just them showing up to respond to a disease.
Right. Reactionary.
Right. And it needs to be physician-led, because we are the ones with the highest level of training.
I guess we'll get there one day.
Hopefully.
That's why you're in a good position.
Yes.
Big smile there.
Yes.
Now, you might be wondering why I'm interviewing a doctor and I'm a real estate broker. It's because we're building a network for people down here. Restorative healthcare is a big issue. Mortgage brokers, insurance, handyman, builders, things like that. So when you do move down here, you're located in the Main Street area on the north end of the island, right?
Correct.
Do you want to give these viewers any more information about
Yeah, absolutely.
Because I know you could talk all day on
Oh, I
this.
1000%
Yeah,
can talk
right.
all day about this. Yeah, you know, as you know, things happen around here with a handshake, right?
Yeah.
This is a very relational part of you have to have underlying relationships in this area to really flourish and
Right.
get things done.
Right.
And so that's a big thing within the office here is, you know, a lot of people come down here, like moving from, let's say, the Baltimore area, and they're used to having the Johns Hopkins network at their fingertips,
right.
and that's not going on down here.
Right.
So even just coming in and letting us point them in the right direction for, you know, what other specialty services
that's
they
good.
might provide too. Yeah. You know, Novant Health is coming in, and they're making a big investment in our community right now to expand our healthcare network, but it's still a work in process.
Yeah.
Although I'm very excited to see it. But yeah, calling our main number, 843-681-7777, and speaking to one of our staff members. No phone trees, only real people.
Real people.
Yes.
Okay. Okay.
So calling, making an appointment to see either myself or one of the chiropractors for evaluation to see what we can offer in terms of keeping people healthy and moving the right way.
Now, I'm not just saying this because you're here, but I'm a bit of a critical person on businesses, and my wife worked at the Ritz-Carlton for years in Naples, and I'm telling you, everybody here, hello, Mr. Weber.
Yep.
What can I get for you, Mr. Weber?
Yes.
So anyway, it's just top notch, and that's training also, and you've got great people.
I appreciate it. Yeah. One other thing here is too, people are not going to have a traditional healthcare experience in this office. Right. Even when I go see my family practice doctor, who I love, I have to brace myself for probably how I'm going to be treated by.
That's true. That's
staff.
very
No,
true.
Yeah,
Yeah, that is true.
But here, like, we're very intentional
yeah.
about how we hire, so that the people who are here, they're invested in patient health as well, and they want, like, we want to see patients do well just as much as the next person.
Yeah,
so.
yeah. Now, Dr. McGinnis looked at my X-rays today because I'm midway through. He was all fired up.
Oh yeah,
he was excited.
Yeah, he's
look at that. Yeah. It's twice as big now.
Yeah.
So yeah, he was great.
Yeah.
So
Dr. McGinnis is really good.
Anyway, this is an ongoing thing.
Yep.
You're part of the team on Low Country Connect, and we will continue to promote you.
I appreciate it.
And you're going to see our clients will call you
because
they're looking for, especially medical or healthcare. For sure.
Yeah, and you know, we've been talking a lot about disease and dysfunction, right?
Yeah.
But people do come to us feeling good and just wanting to be the best they can be.
Oh, that's good, yeah.
You know, and even for golfers, I'm sure there are some golfers watching this right now. Yeah.
Dr. McGinnis did say I should be able to hit the ball a lot longer, farther. We'll see. Okay.
Yeah. We've certainly seen some improvements
That's
on
good.
Drives from our
and professional golfers coming here,
Oh
right?
yes.
Yeah.
Professional golfers, professional tennis players.
Yeah.
Yeah.
That's great.
Yeah.
Anyway, when you come down to the Low Country, check out the Fraum Center. They're here in Main Street. And just to come in and check it out and talk to Dr. H.
You don't have to live here for me to take care of you. About 30% of our patients live out of the area.
Really? Mm-hmm. There you go. Okay. Anyway, come down and see us.